Good afternoon, and thank you for joining us for this community briefing on COVID-19 and our community's response. Joining me again is interpreter Sharon Sinkler, and thank you, Sharon, for being here today. And thank you to all of you who are tuning in and to the media who are helping to get out our message. We want to remind everyone to visit our website, covid19.lincoln.ne.gov, for the latest information about how you can protect yourself, your loved ones, and our community during this pandemic. Since this morning, the health department received notice of another individual who has tested positive with COVID-19. With the 3 we reported this morning, that makes 4 new lab-confirmed cases of individuals with COVID-19 in Lincoln today. The total number of individuals testing positive for COVID-19 in Lincoln now stands at 56. Here to provide more details on the health department's investigations of these cases is Interim Health Director Pat Lopez.
Good afternoon. Today's cases include 2 men in their 50s, 1 man in his 40s, and 1 woman in her 20s. Investigations are ongoing, but of the cases over the weekend and today, 5 are known to be community spread. So that brings the total in our community to 37 cases that are community spread. All are isolated and close contacts are self-quarantined. We currently also have 4 residents hospitalized with COVID-19. Nebraska now has 816 cases and 17 deaths that include our 1 death in Lincoln last week on April 8th. We are continuing to see an increase in the ability to provide more testing in Lincoln. A major reason is drive-through testing sites at Bryan's LifePoint Health and CHI Health at North Star High School. Bryan Health can do approximately 80 to 110 tests a day, and CHI is increasing their testing every day. If you have symptoms or are concerned about a close contact, about being a close contact of someone diagnosed with COVID-19, you're encouraged to take advantage of this drive-through testing now that we have more testing available for those outside of just our high-risk population. Again, the drive-through service is only available by doctor's order and appointment only. You can access the information online at both Bryan Health at bryanhealth.com or CHI Health at chihealth.com. Once you've been tested, you need to self-quarantine at home until the test results come back, which generally takes about 48 hours now. That's a real huge improvement of what we have experienced recently. So I really encourage those who may have symptoms to contact your healthcare provider and discuss it and get in for testing if they deem it necessary. Currently, we're fortunate to have a low number of positive cases compared to other communities in the country or even in the state based on our population. However, with more testing, we could see an increase in positive cases. One of the numbers we are especially interested in is the positivity rate. This is the number of positive tests compared to the overall number of tests being completed. For instance, today we have about a 3.5% positivity rate. Nationally, the CDC is reporting about a 16% positivity rate, and our state is reporting a 7.4% positivity rate. So this tells us that the measures that we're taking are really having an impact in our community. So I also want to mention to you today that allergy season is upon us. As you know, seasonal allergies, chronic pulmonary disease, and other health issues may cause respiratory symptoms. It's very important to communicate with your healthcare provider about your symptoms and follow their treatment and guidance.
Thank you, Director Lopez. This weekend presented special challenges for our faith communities, and we appreciate the efforts of our local congregations to observe Easter safely. We want you to know that the sacrifices that we are all making at this time will help make it possible for us all to gather in person once again sooner. It's also important to remember the basics at all times. Please stay home as much as possible. Please stay at least 6 feet away from others. Wash your hands thoroughly and often. Disinfect high-touch surfaces, and wear a face covering anytime you're out in public. I know that we are all weary of these restrictions, but this is not the time to let up. The next few weeks are crucial as we all do our part to defeat this virus. Today, we are going to focus some discussion on an important topic, and that is preventing domestic violence. According to a 2010 study by the Centers for Disease Control and Prevention, more than 1 in 3 women in America have experienced rape, physical violence, and/or stalking by an intimate partner, defined as a current or former spouse or partner, in their lifetime. And according to the Justice Bureau, the number of domestic violence cases, which includes assault by intimate partners and family members, made up more than half of all serious violent crimes in the United States in 2018. Here in Lincoln, our shelters for people experiencing domestic abuse are almost always full and have a long waiting list of people waiting to access their safe quarters. Now that we find ourselves navigating a pandemic in which our top priority is to keep everyone safe and healthy, we know that those who suffer from domestic abuse may find themselves in a particularly precarious situation. And while it is vital that people stay home as much as possible to prevent the spread of COVID-19, we recognize that some individuals may take advantage of an already stressful situation to exert and maintain control over their partner or family members. Individuals who are already living in an abusive situation may be experiencing more serious abuse because their abusers feel a loss of power and control during this pandemic, or because they themselves are no longer able to leave home to go to work or school. With this concern top of mind, we are closely monitoring the data that we have, and our health department has provided referrals to callers to their hotline for COVID-19 to help prevent a rise in domestic abuse during this time. The Lincoln Police Department routinely tracks trends in the nature of the calls they receive. Over the last 7 weeks of increased physical distancing, they have found that the weekly average calls related to domestic disturbances has actually decreased 20.5%, and the weekly average calls for domestic assaults has decreased 9.6% compared to the 5-year average. However, this does not necessarily mean that domestic violence is occurring less frequently, as some victims may have a harder time reporting abuse if they are spending a greater amount of time in close proximity to their abuser. The chief executive of the National Domestic Violence Hotline expects the intensity and frequency of abuse to increase even if the number of individual cases does not, as this has been the pattern observed following other traumatic events, including Hurricane Katrina, Hurricane Sandy, 9/11, and the recession, the economic downturn of 2008. To help mitigate the likelihood of escalating domestic abuse, we all need to be aware of what abusive behaviors look like. Abuse can be verbal, emotional, physical, sexual, psychological, or economic. Red flags or signs of an abusive relationship may include physical violence, such as hitting, kicking, and punching, preventing access to family finances, destroying property, verbal berating or threatening violence, monitoring or controlling where a partner goes or whom they see, restricting access to family or friends, accusations of infidelity, and of course, unwanted or forced sexual activity. If any of us see these behaviors, we should take them very seriously. Domestic violence can result in death or serious injury, isolation, emotional damage, and poverty for survivors. For those who are living in an unsafe environment, we want you to know that help is available. We encourage anyone who believes they are experiencing domestic violence or who witnesses abusive behavior to call 911. The Lincoln Police Department is always available to respond to suspected domestic violence. For those who may not feel comfortable or who are unable to call the police, there are many community resources available as well. We have two guests joining us today via Zoom who will provide more information about the free resources available to help survivors of domestic violence in Lincoln and Lancaster County. First, I'd like to introduce Marcy Metzger, the Executive Director of Voices of Hope. Voices of Hope is a Lincoln-based nonprofit organization that provides information, counseling, advocacy, and case management to survivors of domestic violence. And with that, Marcy, I'd like to turn it over to you. And thank you so much for joining us today. So Marcy, you can go ahead and unmute and take it away. Can you hear me, Marcy? Go ahead and you can start your conversation.
Marcy, you're up.
Well, while we're having a little bit of technical difficulties, why don't we go to our second guest, who is also someone who provides valuable resources for our community through her work as the Executive Director of Friendship Home. Amy Evans is here, and Friendship Home is a Lincoln-based organization that provides advocacy, case management, and emergency shelter to survivors of domestic violence. And she'll be discussing the services that Friendship Home provides. And with that, Amy, I'll hand it over to you. Hi, Amy. Thank you for joining us. You can go ahead and start speaking. Go ahead, Amy. All right. All right. With those technical difficulties, I'm going to go back to Marcy and see if Marcy can speak. Can you fix the sound in here? Apologize for the technical difficulties. While we wait for those to get worked out, I'll just talk a little bit about what Voices of Hope does for our community. Domestic violence and sexual assault have always been prevalent in our communities, and Lincoln, Nebraska is no different. Voices of Hope has been responding to these kinds of crimes for more than 45 years. And so that's why we are hoping to have Marcy available to speak with us today. Amy, are you with us? Can you hear me?
I am. I can hear you.
All right, we're going to hand it over to Amy at Friendship Home now. Thanks so much for joining. Why don't you go ahead and give your remarks, Amy?
Thank you so much. I'm Amy Evans. I'm Friendship Home's Executive Director. Friendship Home provides safe shelter, crisis services, and transitional housing for victims of domestic violence in Lincoln and Lancaster County. Most of us are being encouraged to stay at home right now under the assumption that home is a safe place. It's really important to remember that for many victims of domestic violence, most of them women, home is the most dangerous place in the world. We have victims who are home right now we're very concerned about at Friendship Home because they're at home with their batter 24/7. The violence is unrelenting, the tension is unrelenting, the emotional abuse is unrelenting. Their batters are not even leaving home to go to work. And that kind of unrelenting violence with no respite takes a huge toll on both physical and emotional health. We have victims who feel that they can't even call the police or can't call out for help because they're afraid their victim will be their batterer will overhear them. Excuse me. They feel really trapped. And I think a lot of us are. We're feeling a certain loss of control as we're at home. Um, it's important to remember that situations like COVID-19 or natural disasters don't cause domestic violence, but it becomes much worse. Because when batterers feel a loss of control, they often escalate their violence. So they increase the intensity of the violence, they increase the frequency of the violence. And so victims are truly stuck in a lot of ways in a situation in which they feel there is no hope. But in fact, there is hope. At Friendship Home, we are still here for them, and we want them to know that. When people think about domestic violence shelter, they often think about a large communal. And so they may think that there's a higher risk of contagion, but in fact, we're really fortunate at Friendship Home because we have single family shelters all across the city. They are apartments for families, just one family per apartment. They are warm and cozy. They are decorated by our dedicated volunteers. Domestic violence right now. So we want to encourage victims of domestic violence to reach out if they're not feeling safe in their own home. If you are at home and not feeling safe, if you need safe shelter, or if you'd just like to talk to somebody about what is going on in your home and explore the option of shelter, please call our shelter hotline at 402-437-9302. I also just wanted to mention that in this situation, partners are exploiting their victims' vulnerability because of COVID-19. So, for instance, reach out, go to a hospital after they've been battered because they fear being to the virus. They fear bringing the virus. Batterers are withholding health care from their victims. They're taking the insurance cards away from them. So they're in a situation that's even more vulnerable. If they've lost their job due to the pandemic, they may be dependent on their batterer for housing and sustenance. So they're incredibly vulnerable. Now more than ever, it's really important that Friendship Home be there for victims of domestic violence. And I would encourage anybody who wants to make sure that these services, these life-saving and life-changing services are there for victims of domestic violence to consider a donation at Friendship Home's website at www.friendshiphome.org.
Thank you so much for what you and Friendship Home do. We are so lucky to have the resources that you provide in our community.
I want to thank our mayor for being concerned about domestic
violence victims and their children across the city. Thank you so much.
We'll see if Marcy is available to speak about the services provided by Voices of Hope. Marcy, are you able to tune in? I'm so sorry, Marcy. We are having trouble hearing you right now. We know how important the work you do is at Voices of Hope. You've been a part of our community for so many years, and your leadership is really appreciated. If we can't resolve the technical issue, I'll go ahead and read a little bit more about what you do. Great.
I'm sorry. I thought I had been speaking earlier, and then apparently I wasn't. So thank you very, very much for including me and Voices of Hope in the conversation, highlighting domestic violence and the challenges of responding in this times. And I think Amy did a wonderful job about talking about why we need to be having these conversations right now with domestic violence and sexual assault being so prevalent in Lincoln. Voices of Hope's been around for 45 years trying to respond to these things, and so feel like this is a time that we need to continue to come together to work on this. When we talk about stress and job loss and all the other pressures that people are experiencing right now, it's really important that we understand that domestic violence is a pattern of power and control, and that the individual act of physical violence by somebody who's abusive is not typically just all of a sudden happening now, but it certainly is exacerbated, as Amy talked about. When we talk about isolation, which is one of the major tactics that batterers often use, we're thinking about how often individuals are locked in their homes with somebody who is abusive to them and have very little access to resources. And so I wanted to take the time to remind people to pass on the message to their loved ones or to know themselves that if you have a cell phone and it is charged, you can call 911 anywhere in the country, no matter if your cell phone service has been turned off or not, as long as it's charged, and our police department will respond. So when somebody is able to reach out, Voices of Hope's crisis lines available 24 hours a day. Advocates are available to take calls, have virtual contact with victims in the emergency rooms, with law enforcement interviews and court meetings, as well as general case management and support. But safety planning is really one of the most critical things that we're providing, and it's really different with each person. These survivors are the experts of their safety, and so they really know what it is that will make things worse for them or better for them if they understand what resources are out there. So we've been talking to a lot of women who have been hiding in their closets in their bathrooms because their batterers are still in the house and they can't get out, or with calls from friends or clergy or family members who are the safety link to victims. And we're just wanting to make sure that people know that resources are out there, and 24 hours a day they can call the crisis line. Protection orders are another thing that we're hearing a lot of misinformation on. They are still being granted in Lancaster County, and the Victim Assistance Unit is available from 8:30 to 4, and they're assisting for individuals that are screened to come and help fill out these orders. But Voices of Hope is also walking people through the protection order applications and filings and orders, and Legal Aid of Nebraska is still providing attorneys to attend these hearings for domestic violence and these protection orders. The other thing that Legal Aid of Nebraska is doing is they're also, they have their hotlines available, and they have a specific domestic violence project. One of those lines, though, is specific to working with related to COVID-19 cases. And so, as Amy described earlier, somebody who's been told that they no longer can have their insurance by their abuser, or that their apartments who their abuser are not living with, but is somehow on their lease, have all kinds of issues that come up because of this virus, and they're able to talk with legal aid attorneys to be able to walk through some of those things. So I just wanted to be sure that people knew that domestic violence was taking place in Lincoln, and that resources, although they're being given and provided somewhat differently, they're still out there and they're available 24 hours a day. And we are so fortunate to have a community that has a very coordinated response. We work very closely with our police department and with the shelter and courts, and we will continue to do that. Our 24-hour crisis line number is 475-7273, and you can reach us also at that number 24 hours a day. 4 calls can be answered at a time. It doesn't make any difference how many people are calling. Please make sure that that number is out in the community. But you can also reach us through our website. We'll be able to answer those kind of contacts too, because sometimes people need to text or go through websites instead of being able to talk when they can't do those kind of things in front of their abusers. Voices of Hope is trying to get phone cards and diapers and all of the kinds of things that happen when individuals are isolated in their homes and needing additional assistance to the clients that we're working with already. So please pass on the message that we're still here and want to know what needs people have. And Mayor, I just want to thank you so much for raising awareness about this today, because I think lots of people are afraid to call the police. They're afraid of being homeless. They don't know that shelter is still available. They don't understand that law enforcement will assist them, or that Voices of Hope can help them safety plan. And it is still available in Lincoln, Nebraska. So thank you for raising the awareness about this today. And sorry about the technical difficulty in my getting on.
No worries. Thank you so much, Marcy.
Thank you for what you and Voices of Hope have been doing for 45 years. Thank you for answering the call of people who are desperately in need of your services. And Amy, thank you as well for providing shelter to those who are able to flee their abusive situations. Again, I want to just repeat your profound messages that resources are available to those in our community who are experiencing domestic violence. And we encourage anyone who witnesses abusive behavior to call 911. The Lincoln Police Department is always available to respond to those calls. And for those who do not feel comfortable or who are unable to call the police, we want you to, again, hear those numbers for those hotlines. The 24-hour hotline for Voices of Hope can be reached at 402-475-7273. The number for Friendship Home's 24-hour hotline is 402-437-9302. In addition, the National Domestic Violence Hotline is always available at 1-800-799-7233, or you can contact them by texting LOVEIS, that's LOVEIS, to 22522. Last but not least, if you or someone you know is experiencing violence in an intimate relationship, we want you to know that you do not deserve this, and it is not your fault. Only your abuser is responsible for the violence. Please know that there is hope for a better future. With that, we will conclude our briefing by sharing some positive news. The University of Nebraska Extension and 4-H has developed a Hats for Hospitals community service project that launched on March 25th to address the need for cotton surgeon hats to be sewn for the medical staff at Bryan Hospital in Lincoln. And in just a few weeks, hundreds of yards of fabric have been donated and hundreds of hours have been spent by many 4-H and volunteer community sewers all across Lancaster County, and they've completed over 400 surgeon hats. Many more are still in production. One 13-year-old 4-H'er has sewn over 60 hats with plans to sew more. Another volunteer has sewn 70 hats. The outstanding response to this need is just another impressive example of the generosity of our Lincoln community. You can find more information about this program and how you might be able to help at lancaster.unl.edu/hats for hospitals. And thanks to all of those who've already contributed. Speaking of contributions, as you may recall from last week, we reached out about the need for assistance in supplying our first responders with face coverings and other protective wear. We are grateful and pleased to report that our Lincoln Police Department has received a donation of about 1,000 face coverings from many different donors. The majority came from the folks at So Creative. All LPD employees now have 2 face coverings each, and LPD hopes that they all will have at least 3 soon. Chief Bleimeister tells us that Sergeant D. Tupin has been a hero in these efforts. About 2/3 of our Lincoln Fire and Rescue employees have a face covering now, and LFR expects another delivery of face coverings from Duncan Aviation today. Duncan Aviation has enough fabric to produce about 8,000 face coverings, and they are procuring more drawstrings to be able to complete their project. Interim Fire Chief Pat Bohr said that a group of LFR employees led by Kim McKay and Alice Dalton volunteered their time and materials to make about 100 face coverings. Again, we cannot thank everyone involved. We can't thank them enough for their support and assistance during this challenging time. Another note about LFR, Lincoln Fire and Rescue also launched a new public education effort today. Firefighters are generally very involved in school programs, and tours, and rig demonstrations, and they are continuing those education efforts now online. Every Monday, you'll find a new episode of a program called The Fire Escape on LFR's Facebook page. And finally today, we want to share more wonderful art that has been created by Lincoln children as part of the Sunshine Kids for Seniors project. We plan to share these at the beginning of each week, so we are kicking off Sunshine Monday today. Aging Partners is helping children connect with our homebound seniors by sending notes and artwork. If your family would like to participate, you may send your scanned notes and artworks with just first name only, please, to sunshinekids@lincoln.ne.gov. Again, that's sunshinekids@lincoln.ne.gov. And before I open it up for Q&A, I just wanted to reiterate that Interim Director Lopez is still here from the Health Department, and our Chief of Police, Jeff Blymeister, is also present to take questions should you wish to ask them. With that, I open it up to the media for questions.
Hi, Mayor Dunker from the Journal-Star.
Hi, Chris.
Hey, so we've seen kind of an uptick in cases at meatpacking plants and food processing plants across the state. Are you aware, or is Interim Director Lopez aware of any cases linked to food processing businesses in Lancaster County at this time?
I'll let Interim Director Lopez take that question. She's right here.
No, we're not aware of any cases in any of our larger plants here at this time. I know that they put in extensive measures in some of the other areas of the state. We have continual contact with the health directors in those areas related to the case investigations.
What kind of measures are you talking about there?
I know that in a lot of those areas, they set up additional testing of employees and working through processes for how to keep people safe in the work environment. So there are many efforts going on in helping people come forward also and receive testing.
I have some more questions for you, Interim Director, before you leave the podium there.
Sure. Sorry.
That's fine. Now that the number of cases is climbing here in Lancaster County, is the same amount of time and effort going into tracing exposures of the positive tests? Where these people went or before being exposed to the virus?
Yes, we're still spending that same amount of time. We still continue to find that people have been self-quarantining and then self-isolating at home in these situations. And we will continue to do case contact tracing for a time period yet. We're not at a level. And we'd have to have a lot more testing done to determine that we're not going to be doing that.
Can you provide any details about what those investigations have revealed about the community spread cases? I mean, are these individuals who were out and about, or were they observing some of these directed health measure recommendations in the state prior to getting the virus?
I would say almost all that we found really are working. We have some situations under investigation, so I can't really give you the whole picture yet, but the ones that cases that we have investigated, these are people who started to maybe weren't feeling well and began to stay home before they had any exposure other than going to their healthcare provider. So we've been really fortunate because people have really been listening to that message. If you're not well, stay home and get in touch with your healthcare provider. And we feel it's made a tremendous difference in the community in linking, trying to look at what we're looking at, how many of the cases might be related to each other, and for any other commonalities. Now, that's not to say that that can change at some point, and we may find some differences, but our situations have been cases where it's been the close contact of the individual that may have become infected, but in general, they've all been staying home. We're very fortunate.
I have one last question, and then Bill, you can jump in. Are you still early on? They were identifying places where some of these folks might have gone. Are we still doing that, or how are you notifying people who may have been exposed to the coronavirus here in the community?
Thanks for asking that question. We frequently are asked about that, and you may recall in Omaha initially they were saying where people had gone, if they'd gone to several areas. And if you think back about that time when that was when they had 1 or 2 cases. So we were trying to do really that case control. In Lincoln, what we found is that people, as I said, are self-isolating. They're staying at home. They're self-quarantining. They're not going out. Now, that's not to say that I'm going to give you a great example we used, I think, the other day. Let's say there was a birthday party, and we would hope that would not be happening. But if that were a situation and we had multiple people involved there and we started seeing positives, we would make the community aware of a situation like that. But that's not the situation that we're seeing here, where we have an outbreak related to a specific area or a specific event. If that were the case, we would be doing investigation and alerting the community, because we would want people to get in and get testing done.
Director Lopez, this one is for you too. This is Bill Shammer with 1011. It's kind of on the back of that question, if a fast food worker or somebody that was working a drive-through were to test positive, somebody that would have come into contact with a lot of people, is that something that would be notified to the public in general?
It would, Bill, it's hard to answer that. In general, we would do the investigation. We would follow all the right courses. And if it was in the best interest of the community to notify them, we absolutely would be notifying people and talking about that, because our goal is to protect the community and prevent the spread of the disease.
Looking at some of the data, Lincoln is not seeing that exponential growth, at least not yet. But 66% of the cases here in Lancaster County are community spread. So how prevalent do we believe it really is here in Lincoln?
Well, if you look back at our numbers from last week, alone 90% of our cases were community spread. So we feel it's very prevalent, and that's why we're urging people to stay home and stay healthy. Because of that, we should all be taking those precautions when we're out in the public, limit our time out in the community. All of us need to be thinking about that. I think about it every time I have to go somewhere and do something. And outside of my work, I'm limiting wherever I go, and my family is also.
It's a fairly big population center, the second biggest in Nebraska. We did a per capita article a couple days ago that shows Lancaster County actually ranks 34th in positive test per capita. I'm curious as to how you might be able to explain that. Is it just the good work of citizens, or what do you believe?
I think we've done a lot of education with citizens. We acted early. We have people who are responsive in our business community who have done everything they can to allow employees to telework. All of the measures that we put in place, we did sooner than some of the other areas of the state. And I think we all know what the growth of cases that are happening, say, in Hall County, is related to one particular situation, one industry, and that's not what has occurred here.
Thank you. Any other questions from the media for any of our guest speakers or the chief?
I have one for Voices of Hope and Friendship Home. I know that this kind of information is sensitive, but have you seen an uptick in calls recently? As we've all been kind of trying to stay in more at home.
This is Amy Evans at the Friendship Home. We've not seen an uptick in demand for services right now, and that's really fairly consistent with what happens in emergency situations like this. First of all, because of all of the reasons I described before, where victims are feeling that they're feeling really dependent on their batterer, it's difficult to reach out for help. They may have lost their job and feel very dependent upon their batterer. They may not be reaching out for help right now, but we may see an upsurge. We can expect a real surge in requests for shelter just as soon as it is safer to reach out for help. I also think that part of that is because people do tend to think of shelter as being a large communal environment. And it's very important that they recognize that there are other options. There are single family options that keep victims safer in times of pandemic. So I really appreciate the opportunity to get the word out about that.
Hi, Chris. This is Marcy Metzger from Voices of Hope, and we have seen quite a substantial increase through our crisis line. But I don't believe that that's because there's so many more domestic violence cases. We get the daily incident reports from the police department, and we aren't seeing an increase. If anything, we're seeing a slight decrease for all the same reasons that Amy was talking about in terms of people not only being afraid of what's the predictability. Are they going to get somebody to come and respond? And then when they do respond, would somebody be arrested? Would their partner be put in jail? Would they have the ability to leave the home? Would they have to be homeless or go into a large shelter? So I think that there's been a lot of things that are funneled through our crisis line and through our websites, because that's the link people can have. Last year, we had 2,000 people walk in the door at Voices of Hope. And so since we're doing some social distancing, it isn't so easy for people to walk in the door. So having such a substantial increase through our crisis line, I think is a good sign, because I think it means that people are letting people know that those services are available, or when there's questions related to things, that they're contacting us through the crisis line.
So if they're calling the crisis line instead of walking through the door, I mean, are they able to get the services that they need, or are they just calling just to talk to somebody, about their situation? Can you kind of illuminate some of that for me, please?
Sure, Chris. It's really different with each caller. So we are doing a lot of things by virtual. So if somebody's calling and saying, I'm needing to go to court for a protection order, and I'm needing somebody to talk through what that's going to be like, or go with me, or figure out how to get transportation, we're still doing that. We're doing things more virtually or by phone, but we still are sending individuals to some of these things when it's safe, for both the related to the virus, but also related to, we are not going to the emergency rooms right now in relationship to domestic violence, in terms of physically going to the emergency rooms, but we have been getting daily phone calls from the emergency rooms for us to talk to individuals. So what we're doing is, whether it's a virtual discussion with somebody, or whether it's a phone conversation, we may be talking through, here's how you get a protection order, here's what might be available to you in terms of a support group. We've started some of our support groups to happen virtually, and so some of the things that we're doing for individuals that are tied into the CPS system, or who are doing some things that tie into economic stability, we've continued, or we've just started doing more of those groups virtually. So we're trying to provide the services that we were providing before, but doing it in a way that's somewhat different than we were because of the social distancing. It's really important to us that we don't have individuals out in the community, both our staff or the individuals but we also don't want people to be isolated in their home. So we're doing everything that we can, working with our partners to make sure that these services are available, just in different ways. Like I said, daily we're getting the incident reports from the police, but we also work with the domestic violence specialists regularly. And so sometimes he's calling and saying, I got to get this person, and they have no gas, and so we're getting a gas card to them. So I think all of those things that I was talking about earlier, in terms of making sure that people are not isolated in their home, that they are believed, that they're supported, that they have somebody to safety plan. We're doing all those things. We're just having to do them in a different way.
If I could just mention that sometimes new approaches grow out of crisis situations. And we find that we have new ways and maybe sometimes even better ways to serve victims. So I'm conscious of the fact that our single family shelter model at Friendship Home grew out of Hurricane Katrina because the shelters in New Orleans washed away, or many of them did. And one particular shelter provider there decided that because they had to continue to provide safe shelter, that they would come up with a stopgap measure, just apartments in the community, rather than rebuilding their communal shelters, because they knew that would take quite a while. So they rented apartments. They let families have an apartment to themselves. They sent services into them. And what they discovered in that process was that it was really a much better model for safe shelter. So even as we're struggling with some very difficult circumstances here, we're also thinking hard about whether there are things we can learn about providing services to victims of domestic violence.
So Chris, I'm just hoping, and Bill also, I know that you're the two.
Yeah, on at this time. I'm hoping that you make sure that our websites and phone numbers, that people understand that domestic violence happening in this community. So if you want to contact me directly, or I'm happy to answer more questions or give you some specific stories.
And I just want to add that that is part of why we chose this topic for today, knowing how critical the services that we have, how critical these services are to members of our community, and that they are still available no matter what. You know, Voices of Hope is still here for you. Friendship Home is still here for you. The courts are still here for you. And LPD, which is known to some to stand for leadership, performance, and dedication, is doing all of those things right now, while so many others across our community are responsibly staying home. Our police personnel are showing up for duty. They are here for you if you need them. Do not hesitate to call them. They are doing their jobs, and we are so proud of them and so indebted to them. With that, are there any other questions? All right. Thank you, Amy. Thank you, Marcy, for joining us. Thank all of you for tuning in and the media for showing up as well. We'll see you again tomorrow.